7:27 in Trinidad and Tobago. Well, that's our video introduction for episode 2 of our Eye Health Awareness series with the collaboration of Caribbean Vitreous and Retina Surgery Limited and the Trinidad Eye Hospital. Today we are focusing on eye health. Our topic today is dry eyes, as you would have seen in our introduction. What is it? Can it be cured? Well, the manager of surgical services and quality assurance, Prianka Persad, joins us now. Very good morning to you, Ms. Persad. Thanks for joining us.
Good morning, and thanks for having me.
Indeed. So let's get right into it. Dry eyes. What are we talking about here essentially?
So dry eye is a very common condition that occurs when your tears are unable to produce adequate lubrication for your eyes. And this can happen because your eye may not be producing enough tears or may be producing poor quality tears.
And I suppose there would be different levels of that. Is it something that can be cured very easily, or are there some serious levels that require greater attention? How would it be graded in that sense?
Yes, so there can be mild, moderate to severe dry eyes, and it's generally treated with drops. So we would use drops or ointments, and then there's another treatment that we've actually just started at our clinics, which is a manual expression of the eyelid glands to help to release the oils, which is a part of the tear film. So it helps to make the eye more lubricated.
And because we're talking about Caribbean Vitreous and Retina Surgery Limited and indeed the Trinidad Eye Hospital, we should give the contact information as well. They are at trinidadihospital.org. They're on Facebook as well. They are located in St. Augustine. You can reach them at 645-7565. And I suppose, Ms. Persad, probably the first thing I should be asking you is that how does somebody know if their condition would be dry eyes? I know you mentioned the challenges with producing tears and so on, but some of us have run out of tears watching the West Indies sometimes with all of the struggles that we face. But what would be a sign to someone to say, look, maybe I should come to your office or come to your facility to have a check and maybe try to verify whether I'm suffering with dry eyes? What should be my indicator of needing some sort of attention?
Well, dry eyes, they carry a lot of symptoms, so there are several. Some of them include stinging, itching, burning of the eyes. There can be redness of the eyes. Some patients will experience a gritty or foreign body sensation as well. There's sensitivity to light. You may have blurry vision, fatigue on the eyes. Sometimes your lids might be a bit swollen, and you can even have watery eyes. So if you are experiencing any of those, it's a good indication to see an eye specialist and get some sort of treatment for it.
Is this something that is hereditary in any way?
It can be, but it's also something that can develop just because of the environmental factors, even too much screen time. You know, people forget to blink when we're looking at screens, so we need to remind ourselves to blink. Give your eyes some rest, close your eyes for 20 seconds, allow your tears to spread evenly across the surface of the eyes to relubricate.
And given that situation, because we are in the time of the pandemic, because so many people are either working at home or students, children spending a lot of time online, are you seeing that happening where a lot of people are coming to the office complaining about dry eyes, complaining about tired eyes, or something to do with their eyes in that regard?
Yes, a lot of people are coming in with digital eye strain, and it's because of the same problem we're having with screen time. So we have to remind them continuously to use your lubricating eye drops, and remember to blink. You know, do the 20-20-20 rule, which is close your eyes for 20 seconds and look at something 20 feet away, just to give your eyes a little bit of rest. Most patients come in, though, we see with something called meibomian gland dysfunction, which is MGD, and that is because the glands on the eyelids get clogged and they're not able to release the oils to lubricate the eye. So we have to do some treatment. So we have a dry eye clinic that we run at CBRS, It's run at two of our branches, which is the St. Augustine and San Fernando branch right now. And it involves a hot compress done in clinic, followed by a manual expression of the glands, which will allow the oils to flow a little bit better onto the surface of the eye to lubricate it.
And given that, is it ongoing treatment? Is it a one and done kind of thing, or obviously probably would depend on the severity of the situation?
Yeah, we generally do 3 sessions for the treatment. And after that, we give you some drops to continue at home. We ask you to do your at-home warm compresses, at-home eyelid massages. And of course, remember to continue your regular checkup with your eye specialist.
And that might very well be the challenge, Ms. Persad, because it's all well and good to be in the office to get the treatment and to take the advice, and then you go home and you forget everything, and you have other priorities, and you forget to do this, you forget to do that. And of course, because of the times we are living in, where people might prioritize other things other than taking care of themselves, their eye health, their general health, and so on. Is that a message that you and indeed those who speak to patients would like to reinforce as far as people being aware? It might sound obvious to take care of your eyes because it's such a vital component to a human being, but is that a message that you have to reinforce?
It is something that we have to reinforce, and we always have to remind patients that we need to have regular eye examinations, so make it a part of your routine medical checkup. Yearly, you should get a comprehensive eye examination. Also, dry eyes, it may not necessarily be sight-threatening, but it is quite distressing and quite annoying. So we encourage people to continue using the lubricating eye drops, continue your dry eye treatment, but also remember to visit your eye doctors.
And as far as the information that you're providing to us this morning in the second segment of our 4-part series, anything additional that you might like to add that you haven't been able to mention so far as dry eyes and eye health generally?
Well, preventing dry eyes is something we can try. So we start with maintaining a healthy diet. Vary your fruits, vegetables, get your vitamins, omega-3s. Continue with your eye drops, continue your at-home treatments as well as prescribed by your eye doctors, and just continue with your examinations with your doctors and your optometrists as well.
And the way I asked the question might have sounded a bit confusing, but I suppose what I was trying to get at as well, apart from that bit of advice that you gave, is that if you have a condition of dry eyes, is that something that is permanent? Is it reversible by the treatments, or will you, because of whatever condition you have, that you will always be in a situation where that you need to take extra special care because of your dry eye situation?
Yeah, it's something that we have to learn to live with. So we have to treat it. It's not cured. So we live with it and we treat it with drops and ointments and eye compresses, hot compresses. So we just have to learn to live with it like that.
And should we therefore minimize the amount of time we spend online, or minimize basically doing things that strain the eyes? Would that help in any way?
It might, but that's also difficult to do in these times. So we just have to try and take some breaks. So frequent breaks would be a good thing to do.
Indeed, that's a good point. You're right. When you're spending inside and around the 4 walls, and you're looking to see the outside world, you have to follow what's going online and so on. It might be very, very difficult in that regard. So before we conclude, Ms. Persad, we want to thank you for taking the time to be with us for this second segment on eye health and awareness, and we're dealing specifically with dry eyes. Just to give us your final reminders again as we talk about managing the situation with dry eyes, please.
So again, dry eyes, it's something that can be treated. So get your optometrist or your eye specialist to look at your eyes and prescribe drops for you if needed. And if you have any of the symptoms that we mentioned earlier, you can definitely contact us at 235-4834 and get an appointment scheduled to see the eye doctor, as well as be a part of the dry eye clinic.
Prianka Persad, Manager of Surgical Services and Quality Assurance at Caribbean Vitreous and Retina Surgery Limited and the Trinidad Eye Hospital. It's a long title, but thanks very much indeed for taking the time to be with us this morning. We appreciate it. And indeed, you can reach them on Facebook. They're on the World Wide Web at www.trinidadEyehospital.org, and the number she just gave as well, 235-4834 for more information, because indeed we all require our eyes, and indeed those who have lost their sight or have it impaired in any way will be the ones who certainly can identify with the challenges that we may face if we don't take care of our eyes. 7:37 in Trinidad and Tobago. Here's an image from Cynthia in Pinal, who says it's peas in season 2021. And now for a couple images from Jackie. The first is a morning view over Mount St. Benedict. Looks as if rain is going to bust down any minute now. That's on the eastern side. And the other is an afternoon view from Mount St. Benedict on the western side. It looks as if those clouds are now heading out towards the west, out towards the Gulf of Paria, and maybe across the Main to Venezuela. We'll take a break.